Nurses are the backbone of healthcare. They are responsible for the well-being of their patients. One of the most critical skills a nurse must possess is the ability to prioritize patient care. In the fast-paced world of a hospital, nurses are constantly faced with multiple demands. Deciding which patient needs immediate attention and who can wait is crucial for ensuring optimal patient outcomes. Imagine a busy medical surgical unit, bustling with activity and the constant hum of medical equipment. In this environment, a dedicated nurse is responsible for the care of 4 patients, each with unique and demanding needs. The first patient is a 68-year-old man diagnosed with pneumonia. He has a critically low oxygen saturation level and is struggling to breathe, requiring constant monitoring and oxygen therapy. The second patient is a 55-year-old woman who is in the recovery phase after undergoing a hip replacement surgery. She is experiencing significant pain and requires regular administration of pain medication to manage her discomfort. The third patient is a 40-year-old man living with diabetes. He needs his blood sugar levels checked frequently and insulin administered to keep his condition under control. The fourth patient is a 72-year-old woman who is in the recovery process after suffering a stroke. She requires assistance with basic daily activities such as bathing and eating, needing constant support to regain her independence. In this scenario, the nurse must quickly assess the situation and decide who needs immediate attention. The 68-year-old patient with pneumonia and low oxygen saturation is the priority. Pneumonia affects the lungs, making it difficult to breathe. A low oxygen saturation level indicates that the body is not receiving enough oxygen. This is a life-threatening situation that requires immediate intervention. Section 4. Addressing the needs of the remaining patients. In a bustling hospital environment, prioritizing patient care is crucial. Nurses must assess and address the needs of each patient systematically. The other patients, while important, can be attended to after the pneumonia patient is stabilized. This patient requires immediate attention due to the severity of their condition, which can be life-threatening if not managed promptly. The patient recovering from hip replacement surgery needs pain relief. Effective pain management is essential for her comfort and to facilitate a smoother recovery process, allowing her to regain mobility and independence. This is important for her comfort and recovery. Ensuring that she is comfortable can significantly impact her overall healing and mental well-being. However, it is not an immediate life-threatening issue. The nurse must balance the urgency of each patient's needs to provide the best care possible. The patient with diabetes needs his blood sugar monitored and insulin administered. Regular monitoring and timely insulin administration are critical to prevent complications such as hyperglycemia or hypoglycemia. This is important for managing his diabetes. Proper diabetes management helps maintain his health and prevents long-term complications. However, it can wait a short time while the pneumonia patient is attended to. Prioritizing care ensures that the most critical needs are met first. The stroke patient needs assistance with activities of daily living. This includes help with eating, dressing, and mobility, which are essential for her daily functioning. While important for her overall well-being, it is not an urgent medical need. The nurse must ensure that all patients receive the care they need, but life-threatening conditions take precedence. Section 5. The ABCs of Nursing, a Life-Saving Alphabet. Nurses use a simple but effective framework for prioritization, ABCs. This stands for airway, breathing, and circulation. Airway refers to the ability to breathe freely. Breathing refers to the effectiveness of the respiratory system. Circulation refers to the flow of blood throughout the body. The patient with pneumonia has a compromised airway and difficulty breathing. This directly threatens his ABCs and makes him the priority. Effective prioritization, the cornerstone of quality nursing care. In conclusion, prioritizing patient care is an essential skill for nurses. It is not just about managing tasks, but about making critical decisions that can impact patient outcomes. It involves quick thinking, accurate assessment, and decisive action. Nurses must be able to evaluate the severity of a patient's condition rapidly and determine the best course of action. By using the ABCs as a guide, nurses can ensure that patients with the most critical needs receive immediate attention. This systematic approach helps in managing emergencies efficiently. In the scenario described, the nurse's ability to prioritize the patient with pneumonia could be the difference between life and death. Recognizing the signs of respiratory distress and acting swiftly is crucial. This highlights the importance of this vital nursing skill. Continuous training and practice in prioritization can enhance a nurse's ability to handle complex situations, ultimately improving patient care and outcomes.